My name is Gaynor Ronsdale and I'm an interpersonal therapist. Interpersonal therapy is a therapy for anybody who's suffering from depression, which may have been impacted by relationships. When we think about the types of relationships, that can often be anything such as perhaps a bereavement that they've experienced that's impacted on their symptoms of depression. It can be perhaps that they're struggling with a dispute with another person that's been really difficult and has perhaps exacerbated some of their depression symptoms. It can be that they've just generally struggled in relationships for a long period of time, with others, not quite sure what that's about, but recognise that they have difficulties in relationships and want to explore what that is a little bit further. Or it could be that somebody's experienced a transition, a life-changing event has happened to them, and they want to explore that and what that means for them and other people around them, and then how that impacts on their depression symptoms. You would be expected to receive 16 sessions. The first 1 to 4 sessions are very much exploring the difficulties, exploring the symptoms and looking at the impact of the symptoms related to interpersonal relationships. We would explore that a lot in the first 1 to 4 sessions. The mid-treatment stage, so sessions kind of 5 to 12, tends to be where the treatment really takes place. There we would explore, linked to what the patient's goals are, how we might be able to help them to understand how some of the difficulties in their relationships is impacting on the depression, what we could maybe do to change that. That can include things such as role play, an exploration of how they communicate and what they get from relationships. So depending on what the patient wants to get from that, we would work around that and do that treatment section. Then towards the end, so the final 4 or 5 sessions, what we would do is we would explore the ending of therapy, what that looks like for the patient, and we would look at maybe early warning signs of depression recurring, and what they might do at that point so that they feel prepared and empowered to manage their own depression following the sessions.